I'm Beulah Dallas, Assistant Professor, Community Health Nursing Department. Today I'm going to discuss about the JSY scheme. The objectives of these sessions are, at the end of this teaching, the students will be able to state the meaning of JSY maternity scheme, list out the objectives of JSY scheme, describe the vision of JSY scheme, enlist the objectives of JSY, explain the strategies of JSY and the role of VHN or ASHA implementing this JSY scheme. What is JSY? It is Janani Suraksha Yojana. So shortly we can call it as JSY scheme. This JSY scheme would be a 100% centrally sponsored scheme. Janani Suraksha Yojana is a safe motherhood intervention which was launched on 12th April 2005 by the Honorable Prime Minister of India under the scheme of National Rural Health Mission. Shortly we can call it as NRHM. This scheme, that is JSY, is a 100% centrally sponsored scheme and it integrates cash assistance with delivery and post-delivery care. This Yojana has identified the ASHA, that is Accredited Social Health Activist, as an effective link between the government and the pregnant women. They are the voluntary service women. They are working as a link between or bridge between the government and the pregnant women. The vision of the schemes are to reduce overall maternal mortality ratio and infant mortality rate, that is MMR and IMR. Also to increase the institutional deliveries in below poverty level families to avoid handling the delivery by the unskilled person through the domiciliary deliveries. The target group for this scheme is all the pregnant women belonging to the below poverty line. This mainly they are aged between 19 years or above up to 2 live births. So these are the main groups we are targeting through this JSY scheme. Objectives of the schemes are to reduce the maternal and neonatal mortality rate, to promote institutional delivery among the poor pregnant women. The strategies of the schemes are early registration of the beneficiaries with the help of the village level health workers like ASHA or an equivalent worker like VHN or UHN. Early identification of complicated cases, that is high risk mothers, providing at least 3 antenatal visit and post delivery visits. Organizing appropriate referral and provide referral transport to the pregnant mother. And also the convergence with ICDS worker, that is Integrated Child Development Services worker, by the way of involving Anganwadi workers intensively and devising as well as ensuring transparent and timely disbursement of the cash assistance to the mother and the incentive to the accredited social health activities, that is ASHA or an equivalent worker with fund available with ANM. The another strategies are provision of 24/7 delivery services at the primary health center level to provide basic obstetric care to the mother, and the provision of first referral unit to provide the emergency obstetric care. Also building the partnerships through a process of recognition with the doctors, hospitals, nursing homes, clinicals from the private sectors, especially in the rural areas, to provide obstetrical services to the JSY beneficiaries. In case of any emergency, we can refer to the private sectors also through this building of partnership with the other NGOs or the private sectors. Let us see the features of this JSY scheme. In the states have been classified into two categories based on the institutional delivery rate, that is low performing states and high performing states. The low performing states, shortly we can call it as LPS, and the high performing states we can call it as HPS. And the second thing is cash assistance linked to the institutional delivery. The benefits under the scheme would be linked to availing of antenatal checkups by the pregnant women and getting the delivery conducted in health centers or in the hospitals. That means during the antenatal period and the postnatal period, the schemes through the linkage of the hospitals or the health center or the primary health center, we are providing to the below poverty level mothers. Let's see what is cash assistance linked to institutional delivery. The eligibility of the schemes, the beneficiaries will be registered themselves with the health workers at the subcenter level or in the Anganwadi or in a primary health center according to the availability of the medical centers, availing of at least 3 antenatal checkups, postnatal care and neonatal care and the institutional delivery. So these are the main eligibility to get the cash assistance. That is, they should at minimum 3 antenatal checkups should be done and they should get the postnatal care and the neonatal care at the hospitals. The gain of this cash assistance schemes is to reduce the maternal mortality by promoting deliveries at the health institutions by the skilled personnel like doctors and nurses. Accordingly, cash assistance is to be provided to women from below poverty line families for enabling them to deliver in health institutions. Mainly, we encourage them to conduct the delivery at the primary health center or in urban health center or in a government hospitals. How we are tackling the pregnancy mother? Each beneficiary they are registered under this Yojana should have a JSY card along with the MCH card. Usually we know that they are maintaining a book. It's called MCH card. That from the antenatal period till the 1 year of the vaccination which received by the child. Okay, along with that, this JSY card also they should get it. That because it's only for the below poverty level women. ASHA or the Anganwadi worker, any other identified link workers under the overall supervision of the ANM and the medical officer or the primary health center should mandatorily prepare a micro birth plan. This will effectively help in monitoring antenatal checkup and the post-delivery care. This micro birth plan already in a book format it is given to the mother when they have to do the investigations, when they have to do the scan, when they have to come for antenatal checkup and when they have to get ready for the pregnancy. All the information is given in that micro birth plan including the iron supplementation also. To get the cash assistance, the mother need to get the BPL certification, that is the income certification. It's a simple criterion for certification of poor and needy status of the expectant mother's family by empowering the Gram Pradhan or the ward members. That can be provided through the Panchayat leader or from the councillor or any other ward member can be certified that the particular mother is belongs to below poverty level certification. The linked worker, especially ASHA or VHN or the UHN, they are getting some incentives while they are supporting this mothers while they are providing the care from the antenatal till the postnatal period. So mainly it is applicable in the low performing states. Here they are providing the certain essential support services to the mother. This is the incentives the ASHA or the VHN they are getting in the rural and the urban. So in the low performing states, that assistance package to the mother that is 700 rupees and for the ASHA it is 600 rupees. Total 1300 rupees it is provided for taking care of one mother. And the urban states 600 for the mother and 200 for the ASHA worker. So totally 800 rupees sanctioning for a mother. And in the high performance states, the assistance per package to the mother, those who are living in a rural area, that is 700. Here they are not giving any incentives to the ASHA, because in the high performance states that is related to the city, so there they are not providing this benefits, because the people are coming directly to the institution, and the total amount, that is 700 rupees, in high performance states they are providing. In the urban states it is not applicable. The scale of cash assistance to the ASHA, that is 600 rupees in the rural areas, that is including 300 for ANC mother and 300 for the facilitating the institutional delivery. In this ASHA package, that is 200 in the urban areas, it include 100 for ANC component and for 100 for facilitating institutional delivery. So here the ASHA, they are encouraging the mother to conduct the delivery at the institutional, that is in the PHC or in a government setup, especially in a government sector. Criteria to get the cash assistance in the low performing states and the high performance states are: in a low performance states, all the pregnant women delivering in a government health centers such as sub-center, primary health center, and in the community health centers, first referral units, or in the general ward of district or state hospitals. And in high performance states, all the below poverty level and the scheduled caste or scheduled tribe, that is SC/ST women, delivering in a government health center such as sub-center, primary health center, community health center, first referral unit, or general wards of district or state hospitals. In the low performing and the high performing states, below poverty level people, that is SC and ST women, in the accredited private institution also. Let's see the role of ASHA by providing this JSY scheme. Each village of 1000 population is expected to have one ASHA or an equivalent worker registered with the sub-center and the primary health center of that concerned village. So mainly these ASHAs are there in the North India. In Chennai we are not having ASHA. Instead of, we are having VHN and UHN. And who would be working under the supervision of the ANM and in tandem with the Anganwadi worker. Under this scheme, that main role would be to organize delivery care services for the registered expected mothers, to assist in immunization of the newborn, to act as a propagator or motivator of family planning services. So as the ASHA, she has to encourage the mother to come for delivery to a government setup, that is in the institutions, and she has to do all the necessary or that is necessary services for the expected mother. She should know the expected date of delivery, and before that she has to go for the regular supervision and to provide the necessary services to that mother. Also, she has to assist in the immunization of the newborn. This at birth we will give the BCG and hepatitis B. That can be done in the hospital itself. But the 1.5 and 2.5 months and the later on, what are the immunization we need to give? Sometimes the mother doesn't know that. In that case, this linked worker, that is ASHA or the VHN, they should remind them and help them to avail this immunization. And also they have to motivate the people to get the family planning services according to the para, that is the temporary or the permanent method of family planning based on their decision making. We should need not to pressure them to follow the family planning services. Their people should motivate the eligible couples to adopt this any kind of family planning services. Also, the ASHA, she need to identify the pregnant women from the below poverty level families as the beneficiary of the scheme, because this ASHA, they are very close to the village people, so they know their socio-economical status, so they can easily identify the beneficiaries, those who are in the below poverty level families, and they should report to the ANM or the VHN or UHN and bring the women to the sub-center or the primary health center for registration. That registration need to be done that before 12 weeks of pregnancy. Assist the women to obtain the below poverty level certification if below poverty level cert card is not available for that mother. Also, the ASHA provide or help the women to receive at least 3 ANC care during their antenatal period. Counsel for institutional delivery and fix before 7th month of pregnancy. Assist in receiving 2 TD injection. Previously, the TT were given. Nowadays, it is changed into TD. So here the tetanus along with this the diphtheria immunization also, vaccine also it is providing to the mother. When the pregnant woman is in labor or faces of complications, escort the woman to the predetermined health center and stay with her till the delivery is complete and woman is discharged. So the main ASHA's workers, they have to, in case of any complications, if they are referring the person from the PHC to the district hospital somewhere else, she should be the escort, that is she should travel along with the mother in the ambulance until she is getting the delivery. She should be with the mother, and she need to arrange to immunize the newborn till the age of 10th weeks, and the register birth and death of the child or mother. Postnatal visit within 7 days after delivery and track mother's health. Counsel for initiation of breastfeeding within 1 hour of delivery, and it's continuous till 3 to 6 months. So the ASHA, she need to go for postnatal visits also. During the postnatal visit, she has to supervise the health of the mother and the newborn. Especially, she has to motivate the mothers to give exclusive breastfeeding to the baby. And after the 6 months, she can educate about the importance of weaning diet also. So the main role of ASHAs are, that is enumeration, survey to identify the beneficiaries, and the outreach services. She has to be there in the village and provide services. She is the linked worker, so she can bring the mother from the village to the government institutions like PHC or the district hospitals or the community health center. And she need to provide the community-based screening also to identify the high-risk mother and any problems during the postnatal and the newborn period also. The risk assessment, awareness generations among the public, and she need to do the follow-up care also. Let me summarize this discussion. So under this JSW scheme, we have discussed about the meaning of JSW scheme and the vision, objectives, strategies, eligibility criteria to get this cash assistance under this JSW scheme. Also, what are the roles of ASHA by providing this JSW services to the below poverty level women. Let me conclude this topic. This Janani Suraksha Yojana under the overall umbrella of National Rural Health Mission. It is being proposed by the way of modifying the existing National Maternity Benefit Scheme, that is NMBS. While NMBS is linked to provision of better diet for the pregnant women from BPL families, this JSY integrate the cash assistance with the antenatal care during the pregnancy period, institutional care during the delivery time, and immediate postpartum period in a health center by establishing a system of coordinated care of field level health workers, especially through Anganwadi worker or ANM or through the ASHA. The JSY would be the 100% centrally sponsored scheme. Thank you for your patience listening.